Hello and good day. My name is Jeffrey. Today I would like to present about my research in regards of challenges in oil and gas environment for offshore medical emergency response procedure system. For my research, this research background is the need to reduce health, protection, and environment risks in the offshore work community was demonstrated by ERP protocol framework. The main objective of this research comprise of the medical ERP requirements that set out for best practice in oil and gas industry. So the requirement adopt a risk-based approach for ERP, embracing three key concepts, which is it applies a time-dependent tier set of response to an incident, coupled with a set of response requirement dependent on the nature of on-site hazard based on each activities and also geographical location. In this research gap, this research was chosen and also examined the difficulty inherent in the offshore medical emergency response procedure by drawing on offshore medic experience in treatment of delays and emergency medical rescue situation. So we use a CIT process and also a qualitative interview to interview four offshore medics that were working in Sabah and Sarawak waters oil and gas facilities. The finding that we found in ResearchGap indicates that in its present practice, the ERP framework needs to be updated and have a suggestion that to change it to industrial guidance on reaction time standard. So means a new interpretation of the problem encountered in the ERP system has been applied to this analysis from a particular perspective. In research design, qualitative interviews were performed to gather retrospective cases from seasoned offshore medic using CIT method. The first one is a question to the medic by choose one of the case and describe the event as much detail as you can recall. Second one is based on this case, are there any complaint raised by the client or other related parties post medevac? Lastly, third question to the medic is what are the delay emergency medevac cases within the past 3 years that you are willing to share? For data collection, we have four types. As you can see, using four types of methods, we have individual interviews, group interviews, and also observation with questionnaires. So type of information obtained involve roles and number of event as you can see at the table. So for the result and the discussion, we find that there are 7 significant findings. So first one is communication, second one decision making, third one is a facility layout, fourth one is a logistic problem, and also fifth one offshore medic response together with the SOP and protocols. Lastly is the weather condition. So let me explain all these 7 significant findings. For communication, communication were ineffective or not communicate until the emergency medical situation is occurred. So decision making is like challenges that are divided into 2 categories, which is the stakeholder and TMS decision. Third one is the facility layout, meaning to say the offshore clinic poses difficulties for the medics to respond effectively to the emergency. Logistic problem is also by delay in logistic arrangement due to coordination is outsourced to other companies. Offshore medic response is mostly on the experience of offshore medic, which is whether they are experienced or inexperienced to handle emergency. SOP and protocols mean to say redundancy in a lot of SOP and changes in ERP procedure, making making a lot of uncertainties when it's coming to a final decision to decide. Lastly is also weather condition. Weather condition is due to bad weather, so there is changes in logistics or they will delay in the evacuation transportation. So for further recommendation in future implication, by using a standard OPITO medical ERP and planning requirement, which are derived from the practice, as I mentioned in the last previous few slides, Also embrace three key concepts, which is like time dependent and set a response, and also geographical location. So as you can see in this table, this ERP procedures system challenges mentioned a few whiles ago. You can see what is the implication to the managers and the HSC personnel. So for tier response description, if we apply this OPITO standard, you can see on the green highlighted font, Shell Malaysia is using OPITO, which is tier 0, tier 1, tier 2, tier 3, tier 4. So in this all this tier, there is a time-based response matrix. For tier 0 is an initiation of intervention. Tier 1 is the first response, like basic life support. Tier 2 is deliver advanced life support. Tier 3 is providing hospital level care. And lastly, Tier 4 is provide definite care. So by having this tier response time for decision making, the gap in the ERP procedure system that was previously unmeasured can now be monitored. So you can look on the left side for tier 1 response, they will respond within 4 minutes. And tier 2, they need to respond within 1 hour. And then subsequently, when they go to topside medical support, TMS, they need to respond within 4 hours, which is a tier 3. In conclusion, to manage medical emergency challenges, each location should develop a site-specific medical emergency response plan that is a very good ERP. So taking account that any potential individual or multiple casualties, we can respond accordingly. So this ERP should consider specific needs for the work activities or the general situation of the country. So may you say resources required for successful implementation of ERP is such as effective means of communication, decisive decision making based on OPITO standard, first responder and trained competent healthcare professional, adequate means of transportation, and adequate medical structure. Lastly is a well-revised SOP and protocol. Thank you so much for listening to my presentation. That's all.